Emerging global tensions and rapid technological change have increased concern about large-scale acts of violence that threaten public safety. Terrorism uses violence to create fear and disruption, often affecting both civilians and government systems. In response to these risks, the U.S. Department of Homeland Security was established to coordinate efforts across federal and state agencies to detect, prevent, and manage potential threats. Events involving explosives, chemical, biologic, or radiologic hazards can cause widespread injury and psychological impact. Although such incidents are rare, nurses must understand their role in caring for affected patients and maintaining safety in complex environments. Explosions and other large-scale emergencies can occur through many causes, including industrial or environmental accidents. Regardless of the source, the same nursing principles apply. Stay alert, protect yourself and others, and deliver care while supporting coordination among response teams. Explosions can occur in many settings: industrial accidents, transportation incidents, or intentional acts. Regardless of the cause, the resulting injuries can overwhelm healthcare systems and require coordinated emergency response. For nurses, understanding the basic patterns of injury and priorities of care is essential. The scene of an explosion presents multiple hazards, including structural instability, contamination risks, and secondary events. Safety and situational awareness are the first priorities. Each scene is also a potential crime scene, so patient care must be balanced with preservation of evidence and clear communication with emergency services. Injury severity depends on several factors such as distance from the blast, the surrounding environment, and available medical support. The pressure wave created by an explosion can cause complex internal injuries that may not be immediately visible, so ongoing assessment is critical. Blast injuries are generally classified into 4 categories: primary injuries, affecting air-filled organs due to pressure changes; secondary injuries, caused by debris or fragments; tertiary injuries resulting from physical displacement or impact; and quaternary injuries, including burns, crush injuries, or medical complications. Nurses play a vital role in triage, airway management, and circulatory support while maintaining safety and communication in chaotic conditions. Blast-related trauma can affect nearly every organ system. Abdominal injuries may involve internal bleeding or organ damage, while head trauma can range from mild to severe and requires careful neurological assessment. Some groups, such as older adults, individuals with chronic illnesses, pregnant patients, or those with limited mobility, are especially vulnerable during large-scale emergencies and may need additional support and monitoring. Beyond physical trauma, nurses must also be aware of potential biologic threats. These involve infectious agents or toxins deliberately or accidentally released into the environment. Because such agents can spread through air, water, or contact and may not cause immediate symptoms, early detection and coordinated reporting are critical. Public health agencies classify biologic threats by severity. Category A includes agents that pose the greatest risk due to ease of transmission and high mortality. Category B causes moderate illness, and Category C includes emerging pathogens that could become threats in the future. For nurses, preparedness means recognizing unusual patterns of illness, using proper infection control measures, and following reporting procedures to protect patients, coworkers, and the broader community. Anthrax infection can occur through skin contact, ingestion, or inhalation. Nurses should watch for fever, fatigue, and flu-like symptoms that may progress quickly to shortness of breath or shock. Skin exposure can cause black-centered sores that are painless but serious. Begin antibiotics immediately. Treatment within 24 hours greatly improves survival. Common options include penicillin or fluoroquinolones, and prophylactic therapy should continue for several weeks after exposure. Use standard precautions, as anthrax does not spread from person to person. Although eradicated, smallpox remains a concern due to the possibility of accidental or intentional release. Nurses should look for a high fever, severe body aches, and a rash that starts on the face and spreads downward, forming pustules that scab over. Isolate patients under airborne and contact precautions in a negative pressure room. Provide supportive care, hydration, and fever management. Vaccination within 4 days of exposure can prevent or lessen illness. Staff who have close contact should also receive vaccination and wear full protective equipment. Chemical exposures can affect breathing, skin, and circulation depending on the type and route of exposure. Warning signs include burning of the eyes or skin, coughing, shortness of breath, excessive tearing or salivation, nausea, confusion, or sudden collapse. Protect yourself first by using proper PPE before entering the area. Move patients to fresh air, remove contaminated clothing, and double bag it. Gently wash exposed skin with soap and water, avoiding harsh scrubbing. Support airway and breathing, provide oxygen, suction secretions, and prepare for possible respiratory distress. Notify the charge nurse, infection control, and emergency response teams immediately. Radiologic or nuclear incidents can cause both physical injury and radiation exposure. Symptoms may include nausea, vomiting, fatigue, skin redness, or burns without a clear cause. Keep exposure time short, maintain distance, and use gloves, masks, and disposable gowns. Wash exposed skin and hair with warm water and mild soap. Place contaminated clothing and waste in labeled containers for radiation disposal, and monitor patients for signs of infection or bone marrow suppression. Radiation exposure can occur in three main ways: external exposure, contamination, or internal absorption. External exposure happens when radiation passes through the body without remaining inside. Contamination occurs when radioactive material settles on the skin or clothing, while internal absorption happens when those particles are inhaled, swallowed, or absorbed, becoming part of body tissues such as the bones, liver, or thyroid. Decontamination should begin outside the hospital whenever possible to prevent spreading contamination inside the facility. Staff must wear protective gowns, gloves, masks, and radiation badges, and all waste should be securely double-bagged. Most external contamination can be removed with thorough washing using soap and water. Internal exposure may require additional interventions to bind and remove radioactive material from the body. High radiation doses can lead to acute radiation syndrome, which progresses in several stages. Early symptoms may include nausea, vomiting, and fatigue, followed by a short period of apparent recovery before more serious complications appear. These can include infection, bleeding, and shock as the body's blood-forming and immune systems fail. The organs most sensitive to radiation include the bone marrow, gastrointestinal tract, and brain. Skin exposure may cause redness or blistering, depending on the intensity and duration of exposure. Nurses should monitor for key warning signs such as unexplained nausea, bleeding, or fatigue following suspected exposure. Patients are triaged by the likelihood of survival. Those with mild symptoms often recover with supportive care, while those with significant or worsening symptoms may need isolation, transfusions, and antibiotics. In large-scale events, care focuses on saving the greatest number of lives while ensuring comfort and dignity for all patients. Across all disaster scenarios, radiologic, chemical, or biologic, the nurse's role is central. Nurses are often the first to identify abnormal patterns, begin isolation or decontamination procedures, and offer reassurance amid uncertainty. Their training, calm presence, and compassion form the foundation of effective disaster response and recovery.